Order. CC number 250 bar C. Complainant Mrs. Papamal. Respondent Dr. Raja. This court has keenly considered all the arguments between the complainant's lawyer and the doctor's lawyer, and based on the evidences, we have come to a conclusion that the doctor has been negligent in his service to this patient, Mrs. Papamal. This court awards a compensation of rupees 20 lakhs to be paid by the doctor to the complainant. The doctor has to remit the sum within this month and in this court.
Darling, one bad news. I have lost the case. I have to sell my house to pay the compensation. No other go.
Already I'm upset marrying you. You don't spend useful time with me, always running around the patients in hospitals. If I cannot have even this house, I will divorce you.
No, darling. No. Hi, friends. Medical profession is a noble profession. Those days, all the people and patients consider doctors as God. But nowadays, the relationship between the patients and doctors is not that good. It is due to various reasons, but it is the duty of the doctor to maintain a very good doctor-patient relationship, and you should make sure that patients trust you. That is very, very important in this noble service. Despite all things, despite all the efforts put by the doctors, of course, any doctor does not want to do something wrong for the patient. Despite all the efforts put by the doctors in treating the patient, sometimes things may go wrong, because we are dealing with live people. We are not dealing with machines. So, despite all our efforts, if something goes wrong, then automatically patients are not satisfied with the doctor and litigations may arise. It is for the doctors to save their skin. For that, we have to definitely invest in professional indemnity insurance. What is this professional indemnity insurance? Despite our efforts, if something goes wrong in the treatment of the patient, then the patient may go in for litigation and you may face court cases or consumer problems. Courts are always with the affected people unless the evidence submitted by the doctor is very, very strong. We have been running around treating so many patients for very, very small money. But the courts may award a big penalty on the doctors, or they may award a huge compensation to the patient from the doctors. So we have to spend all our earned money in paying the compensation. In order to avoid that, definitely every doctor should have a professional indemnity insurance. We have PPLSS in IMA. Many private insurance companies like Oriental Insurance Company, National Insurance Company, ICICI Lombard, and many companies are offering this professional indemnity insurance. Per lakh, it is costing as low as 75 rupees depending upon the insurance company. Let us invest and save our skin in this professional indemnity insurance. Depending upon whether you are a surgeon or only a physician or a paramedical professional, depending upon the risk you are going to take, depending upon the richness of the patient you are going to treat, you can take insurance. You can take insurance for few lakhs or several lakhs or up to a crore or more than that. Actually, it will cost you very, very less every year for this professional indemnity insurance. In a bad day, if you are going to be punished by the court and you have to pay a huge compensation to the patient, then these insurance companies will pay the compensation on behalf of you. When you start a professional indemnity insurance, you should make sure that in the area, what is the territorial limit, you should add it anywhere in India. Because you may be operating in so many places, you may be treating the patient in so many places. Just don't write the address, always make sure the territorial limit is anywhere in India in all hospitals. That thing you have to enter in the application. That is very, very important. Another important thing is, whenever a case has been filed on the doctor in the court, when you have a professional indemnity insurance, you have to request the court to add the insurance companies as one of the respondents. Because if you don't add them as a respondent, they are not liable to pay the compensation. So, you should make sure whenever a case is filed on the doctors, the professional indemnity insurance company should also be added as a respondent in the court, so that every time the case is going on, they also will follow the case and they will be paying the compensation if it is awarded for the patient treated by you. Just because we have started a professional indemnity insurance, we cannot be careless. We have to maintain proper records about the patient. We have to verify them properly. We cannot trust us to do our work. We have to do our work first sincerely and monitor other people's work also. Because only these records will be talking in the court more than anything else. With this, I am going to stop here. Let us hope for the best. Life is nothing but belief.